Welcome to Beyond Beauty, where confidence meets care. Join us as we uncover the art, science, and soul behind today's most refined cosmetic treatments.
Hey everyone, welcome back to Beyond Beauty. My name is Adele and I'm your host, and today I'm joined by Dr. Kelly. Hello. And today we're going to talk about something that honestly doesn't get talked about enough, and that's women's sexual health. So Dr. Kelly, thank you so much for joining me.
Thanks for having me. I love conversations like this. I think it's not talked about enough. Anything focused on women's health I'm very passionate about, so I'm excited to dive in it today.
I love that. And I want to start right there, actually. So why do you think women are still uncomfortable about talking about sexual health?
It has to do with a lot of factors. I think mainly lack of education, stigmatized as well. For many years, women focused on other people, not themselves, not their own health. Same with studies and medicine, just kind of ignored women for many, many years. So I'm passionate to make it more comfortable for everybody and more accessible.
All right, great. So today we're going to talk about the OMG Shot, a new treatment that we're offering at Vancouver Laser. Can you explain it a little bit?
Yeah, so the OMG Shot it has 3 components, so we'll break that down. The first part, the OShot, it's been around for many years. We're trying to bring it back and make it more public and easy to access. And basically what it is, we take PRP, which is platelet-rich plasma, from your own blood. So we take some blood from yourself, we spin it down, and we take the good parts, the platelets. And what we do with that is we inject it into the labia minora and also the labia majora, and that can help growth factors flood into the area and rebuild and rejuvenate. It's a great, for most women, any woman who has vaginal dryness, itchiness, perimenopausal, postmenopausal, young women just with little lack of sexual drive. It has a lot of benefits, and it's done pretty quickly in office, usually within half an hour.
Awesome. Is there an age group that it's more kind of geared towards?
Anyone can have this procedure. I would say it's mostly geared for women who have symptoms or feel like their vulvas have changed over time, become thin, a bit of pain. As we get older and go closer towards menopause, we do have vaginal dryness, and so this can help with that area. Also thinning, so usually age 35 and above is the main target for this procedure. However, if you experience these symptoms younger, you're also eligible.
Awesome. Okay, so that's the OShot. So now tell us about the MShot.
The MShot is not as common as the OShot, but it is still a great procedure. What we do is use hyaluronic acid, and we prep that in a specific way, and we inject it into the labia majora, the larger part of the vulva. And we do that because as we age, that tissue becomes thinner, and then we expose the labia minora more. And so this kind of helps fold the area and bring it more a youthful look. So that one is more for aesthetics than for any type of treatment for fixing a problem.
Awesome, okay. And so last, the GShot.
Yeah, so the GShot is an add-on to either of these procedures. This one helps more for pleasure. So we go into the anterior vault of the vagina and we can put some PRP. We can also add some hyaluronic acid into that area as well. That one is more tailored, personal for the patient's preference. And that basically brings down the anterior vault, which then can penetrate the G-spot easier, and so it can increase arousal and make easier for orgasm.
All right, so we're talking about injections in all of these areas. What can someone expect?
So with any type of injection, any type of needle, obviously a little bit of bleeding post-procedure. We do numb the area, make you quite comfortable, but there can always be a little bit of pain with any injection, especially in more sensitive areas. So we do give people more time to numb before the injections. And then afterwards, a little bit of bleeding in the area is also common.
All right, so do you have any tips to help optimize the results?
Yeah, let's focus on 2 main ones we have here. So we have the Emsella, which is a chair you sit on and can help tighten and strengthen the pelvic floor. We also offer the Lady Lays laser, which is a intravaginal laser that helps tighten the vagina as well as helps with incontinence. These procedures are really good for anyone with a weak pelvic floor, if it's due to menopause, if it's due to age, if it's due to vaginal deliveries, or even multiple deliveries post C-section as well. It doing all these together, obviously you get the best results, but you can pick and choose the options you like. You can try one, try the other, intermix them all. They all have benefits, and we can obviously make a plan custom to you if you come in for a consultation.
That's great.
Yeah. And so we have one more question. Adele, since you had the OMG shot, do you want to talk about your experience a little bit? Were you comfortable with it? How was the pain?
Yes, so I've had all 3 shots, the O, the M, and the G. I was a little nervous going into it because of course it is needles going into a sensitive area. I was quite surprised that it really wasn't very painful, a little bit pinchy sometimes, but I wouldn't really call it pain, just a little more uncomfortable than anything. The procedure was done really quickly. I felt comfortable. Overall, it was a pretty easy treatment to do.
Good. And I know you haven't had it too long ago, but any benefits that you've had so far?
I feel like I've noticed a little bit more hydration. Things have just felt a little bit more generally rejuvenated. I would say that's the biggest thing that I've noticed.
Good. And would you do it again?
Yeah,
important question.
I would do it again. I haven't had a chance to use the OShot yet, but I'll let you know.
Thank you. Keep us updated.
Come back for part 2.
I think we do a really good job here because we take you from step 1 to the end of it. Our entire team for all of our sexual health is a female-run team, from our consultants like Adele to meeting me to talk about the personalized procedure for yourself, and then our staff who preps you for the procedure, gets the numbing ready, make sure you feel comfortable. All women-led and women-run, and we take our time. We don't rush the procedure. We make sure you're comfortable every step of the way and that you're aware of everything that's happening. And there's always follow-ups that are complimentary if you have any questions after the procedure. So I feel like we do a really good job here at taking care of individual people.
All right, Dr. Kelly, thank you so much for joining us on this episode of Beyond Beauty. Final question for you. Can you sum up OMG?
Okay, the OShot, that is PRP for rejuvenation. The MShot is hyaluronic acid for aesthetics. The GShot is for function and improving orgasms.
All right, so that wraps up this episode of Beyond Beauty. Thank you so much, Dr. Kelly, for joining.
Thanks for having me.
And to everyone listening, if this conversation brought up any questions you may have, questions you didn't realize you have, you can always contact our clinic. Our consultations are complimentary and we'd love to hear from you.
Thank you.